The interventions that we can use with the patient that's experiencing depression and suicide include encourage participation in meaningful activities. Encourage your patient to attend groups that may be going on in your programs. Encourage them to socialize with other people. Encourage them in a connection with their religious or spiritual expression. Reinforce their sense of self-worth. Give them positive feedback. Offer choices. With the patient that's experiencing depression and suicide, a lot of times loss of control is huge contributions to that depression. Give them choices and allow them and encourage them to make those choices is very important. Allow your patient to do as much as self as possible. Again, control is a very important issue, and a lot of times patients may suddenly experience loss of control and inability to care for themselves. So letting them do and encouraging them to do as much as possible is very important. Look to your patients for advice on issues that affect them, also helping them to increase their sense of self-control. Encourage self-expression, such as singing and drawing. Encourage exercise. Walk with your clients, especially those who require assistance with walking. Watch for dangerous behaviors or dangerous items that clients may have in their area. Make sure that medications cannot be in their reach or anything that they could potentially hurt themselves with. Report any statements relating to death and dying immediately to your supervisor. Any indication that this patient or any statement that is made by this patient that they're intending to hurt themselves needs to be reported to your supervisor immediately. Report any changes in your patient's condition, especially those relating to sleep and eating, and statements made by the patient and activity in daily groups to your supervisor. The second problem behavior that I would like to talk about is agitation. Some of the signs of symptoms of agitation include using a loud voice, refusing help from family members or from staff, refusing meals and activities. The agitated patient may be striking out or may be attempting to hurt staff. You may see a person who's agitated pacing. The interventions that you can use with the agitated patient include remaining calm yourself. Speak in a quiet tone. Use the KISS acronym. Keep it short and simple. Avoid sarcasm with the agitated client. Make sure that you're respecting the client's space. This will make sure that you're safe as well as respecting the client's space and keeping the client safe. Do not invade their space without permission or without indicating that you may be moving closer to them. Validate their feelings. Acknowledge that they're feeling angry and talk with them about that. Do not rush with the agitated client. Take your time. Talk with them. Explain what you're going to do. Say what you plan to do with the agitated client and receive consent before proceeding. Especially with the confused agitated client, you want to make sure that you're explaining to them what you plan to do and make sure that they know that you're going to put your hands on them if that is what you're going to do. Do not argue with your client or confront the client. Monitor your body language. Make sure you're watching what you're doing. Keeping your hands on your hip or pointing your finger at the client or glaring at the client can cause the client to become more agitated and challenging. Report any changes in the agitated patient's behavior to your supervisor. The last behavior I would like to address is wandering and confusion. Some of the signs and symptoms you may see with wandering confusion are the patient may appear lost. They may not be oriented to time, person, or place. You may see a sudden mood change with this client. This client may be sad and appear to be alone. You also may have a client who rifles through other people's things. Some of the interventions we can use with the confused client include to keep them oriented to time, person, and place. Clearly label their doors with their name. Keep personal reminders near clients, such as a blanket or a picture. Remind clients about important daily events. The one thing that a confused client may do is be confused on the time and may miss dinner or supper or some other type of important event. Refer to additional pages in your student manual for a variety of different measures. And now we'll go back to Nicole, who will talk about the focus model and the golden rules of safety.
In all circumstances, we should remember to use the focus model. First, place full attention on your client's needs. Take the opportunity to support the client. Remain calm. Understand the feelings behind behaviors, and always remain sincere. In addition, always use the golden rules of safety. Never be in a room with the door closed without somebody else being aware of where you are. Use the buddy system if needed. Always inform coworkers of what time and place you are with clients. Always know your client. Always remain calm. If you feel scared, leave the room. And never try to play the hero.
In conclusion, we would like to say that there are a number of influences on feelings that can cause changes in behaviors in both patients and ourselves. It is important for us in the healthcare field to know ourselves, remain professional, and to know our clients. We thank you for joining us, and good luck to you in your future career.